Hi, I'm Jennifer Novak with ORTHO-NEURO Performance Consultants. I'm a distributor and an educator for an amazing photobiomodulation device. If you haven't heard of what photobiomodulation is, it used to be known as cold laser or low-level laser therapy. But the most appropriate name is modulation because these devices actually modulate cellular activity to promote healing, performance, and recovery, and even help with injury management. And so I get to represent this beautiful device right here. It's the Avant Wellness LZ30. It's a red and near infrared device that you can toggle between those two wavelengths at the touch of a button. And purchasing one of these through ORTHO-NEURO, you will get 120 frequency-specific presets that are broken down by tissue type or by condition, and you'll get some education that will help you help athletes and fitness enthusiasts alike be better, recover better, perform better, heal faster from injury. It's just an exciting time to be in this industry and to be providing this device to help solve problems that our industry comes across every day. So I'm going to bring a close-up in and show you some of the ORTHO-NEURO settings that you will get, and then talk you through how easy and portable and programmable and versatile this device really is. Hang tight. So here we are at the tour of the ORTHO-NEURO settings on this frequency-specific red and near-infrared Avant Wellness LZ30 laser device. All you have to do is press the red button that's on the top. You hold it, it turns on, makes a little victory sound, and enter the password. Click the red button again, you're in. And here's the ORTHO-NEURO folder. This is like a little computer, and as you store things in your computer with folders and subfolders, that's exactly how this device works. It's fantastic. So if I go into the ORTHO-NEURO folder, my subfolders start with bone, because most of it is alphabetical order for you. And I have different settings for different conditions that you might come across as a sports medicine or a strength and conditioning professional. My favorite one in here is the fracture repair. The research is out and it shows that it enhances the development of callus formation and speeds up, accelerates fracture repair, which is super exciting if you're in athletics. The next section we have is brain, and there's an entire setting in here, a whole section on concussions, and we've included in there even a concussion gut health setting, and we'll do some education on the patterns for that, because every time someone has a concussion, the research shows that their gut lining changes and it can create an inflammatory process that's hard to stop, and you want that brain to get better fast. The next setting is contusion, which of course is a condition, but it's broken down by the frequencies specific to wherever the insult or the bruise was experienced, whether it's an organ or a muscle or the skin or a bone. It's all set up for you. The next section is for cramping, and that includes muscular and abdominal cramping. Also a setting for menstrual cramping for female athletes. We've got fascia, and included in here are all kinds of maybe inflammatory conditions you would have with the fascia, but also a mechanoreception setting. That's one of my favorites because we know that the fascia talks, it has mechanoreceptors and it talks to the nervous system. And we're all about getting that communication loop sound and responsive. Joint, any kind of condition you would find in a joint, whether it's the labrum or the bursa or the disc in the back, we have all kinds of frequency-specific presets for you there. In the ligament, the same thing. Under muscle, some of my favorite settings in here, I have two different ones for DOMs. If you catch somebody right after a hard workout and you want to try to prevent the delayed onset muscle soreness, there's a frequency for that. And if you've already caught them afterward and the soreness has set in, we have a reduction setting for the soreness. Helps that tissue heal faster. Oh, I also like back to the muscle. I like the trigger point setting. You can actually use the laser to resolve a trigger point. So if you are not certified in dry needling or your athlete doesn't like the idea of dry needling, you can use the laser instead. Nerve is a great section. The nervous system communicates through the muscular system, and we have afferent and efferent pathways depending on the evaluation and what you're finding. We have everything from neuritis to neuropathy and more for your nerve. Ortho injections. These light frequencies are designed to augment when someone has had either hyaluronic acid or stem cells or PRP, and it's supposed to help facilitate why they got those injections to promote the healing of the joint or the tissue that is receiving those injections. We've got a whole pain section, both acute and chronic, broken down by tissue type. Under scar tissue, there are 3 settings. There's a general, a mature scar tissue, and also a remodeling scar tissue. So one is going to work with the mature tissue that's kind of getting in the way of performance. The other one is going to be during the remodeling phase to help mitigate scar tissue development. And the research is all out on this, and this is what we use to make these frequencies. Under skin, you have everything from an abrasion to even infections broken down by bacterial, fungal, or viral, an athletic trainer's best friend maybe in the field. Tendon, we've got tendinitis, tendinosis, tendinopathy, tenosynovitis. Like I said, these are all broken down by what was the best research for dealing with these issues. Under other, this section is things where I couldn't figure out where to fit other things, but I've got asthma, I've got tissue oxygenation, lymphatic clearance, all kinds of things in here. General inflammation, one of my favorites, honestly, is the tissue oxy setting because we know that when tissue has oxygen and blood flow, it's going to heal faster. Then I have a recovery section where we can use patterns to improve HRV and even vagus nerve stimulation, which is a big topic nowadays with regard to recovery, is getting that sympathovagal tone intact and responsive so that that athlete can recover and perform better. So super exciting. I just took you into my ORTHO-NEURO folder. And in my next little section, we're going to talk about how versatile this device is by going into the settings. So now let's talk a little bit about the versatility of this device. It's ingenious. I'm right now inside the settings folder and I'm in the advanced section. So I click right to get into that advanced section. And you can enable a default timer. So say you're a busy athletic trainer and you need someone to receive some red light on a certain frequency for 4 minutes on a certain injury. You could set it on a stand. We have custom made stands to hold this, and you could set the default to turn off at 4 minutes by enabling this default timer. And you can go and help another athlete while this other one is getting that 4-minute dose of light. So that's what the default timer is for. The default dose is actually measured in joules. So if you had a study that told you how many joules of light they used for a certain reason and you wanted to use that same setting, that same amount of joules, this is where you would go and enable that, and you could set it up for I think as little as 5 joules and as many as you needed, right? According to the research study that you pulled out. Pretty cool, right? I'm not going to discuss beam reminder, but you can even set it to alternate between red and infrared. So there's a toggle button. I'm going to turn this real quick. And around the red power button, there are 4 little arrows. And these left and right arrows take you into folders and subfolders, and the up and down take you into the settings within folders, but they also toggle between red and near infrared. So if I turn this on in a setting, which I'll do in a minute, I can press up and it'll go to infrared, and I can press down, it'll be red. So that's pretty cool too, right? So easy. Power control. that is, excuse me, the power control is where you can set the power density. So if you didn't want 100% of the power in this device, which it is the most powerful one on the market for its price point and for what it gives you, you can change it by just enabling power control, and you can go from 100% all the way down to 2% of the power if you wanted just a teeny bit of light, okay? And then you have a custom protocol. So let's say out of these 120 settings, you feel like you need something else, and you read a paper that said, if I have exactly 20 hertz, I can do this with this laser. You can actually enable a custom protocol and make your own frequency, no matter what it is. It can be in the thousands if you wanted it to. So that's it for these advanced settings, but it's super exciting because you can manipulate and change this device for just about any condition or situation. And I'm the one that gets to represent it and help you learn how to optimize your performance, recovery, and injury management solutions with an Avant laser. So I promised I would show you how easy it is to toggle between the wavelengths of red and near infrared in this device. It truly is. Right now I have it open to a general inflammation setting in my ORTHO-NEURO folder. And as I mentioned, there's a red power button, and then there are 4 arrows and a black toggle button around that red button. So once I turn it on, it's going to default to red, and I'll show you that right there. It's pretty bright. But if I wanted near infrared, all I have to do is press the up button. And the only reason near infrared is invisible, but they do give you a guidance light so you can at least know that it's on and working. So again, you just press red, near infrared, and you might choose near infrared over red because of a paper you read. You might choose it because you have found empirically that it works better. Some people mix both when they're utilizing the laser, and I showed you in advanced settings where you can do that and toggle it automatically. It's just a very versatile machine, and I think you'll be super pleased that you have it.